to work around social distancing during the coronavirus pandemic, and with many offices going virtual, including doctors' offices. But does that exactly work if you need to see an eye doctor? So to talk more about how optometrists are practicing, we have Dr. Jason Singh from VisionWorks America. Good morning, and how are you doing this morning?
Great, great. Thanks for having me.
Well, we're glad to have you. I'm one of those people who has eye strain for various reasons, dry eye, you name it. But let's first kind of start talking about VisionWorks. Are the locations currently open and treating patients?
Yeah, so the great thing is we actually reopened locations April 6th as we were deemed essential to meet those essential and emergent eye care needs. In Oregon specifically, we'll have all of our locations up and running in the next really 10 days or so. But the good news is we're covering about 90% of the communities that we're in nationwide already.
That's great because, I mean, a lot of people I know have probably pushed back some needed things just because of this. And if someone visits in person at this point, can you really tell us what they can expect in terms of protective measures for staff and patients? I know people can be a little bit anxious to go in some enclosed spaces.
Yeah, understandably so. And so, we are meeting CDC guidelines in all cases and have been since we reopened April 6th. And you can start by expecting to have your temperature taken before you ever walk into one of our locations, because we know having a fever is the number one symptom associated with COVID. And so we want to give our patients the confidence that they're walking into a fever-free environment. So number one, if you have a fever, we're going to ask you to reschedule. Number two, certainly, if not, we're going to welcome you in and you're going to have that confidence. The second thing you can expect is we're going to have protective equipment for all of our associates and doctors. So they'll be wearing masks, they'll be wearing gloves. Our doctors will be wearing gowns and safety goggles to ensure that you have that safe experience as you're coming in. And lastly, we're really monitoring traffic in our store such that there's a limited amount of people in a store at a given time. So that, again, we can respect social distance in all cases, as well as allow for adequate cleaning to be done between appointments.
All of that's really reassuring, especially as a lot of people will start rebooking. So if viewers do, though, prefer to connect with a doctor online, say they may just have some questions that they want answered versus coming in person, is that something that's possible as well?
Yeah, it's a great point because you could be high risk for COVID, you could be elderly, you could have autoimmune issues. And so we wanted to create a solution within our environment with our affiliated doctors and doctors to provide access. So you can go to visionworks.com and there's a button there for eDoctor. And we've done over 3,500 visits during this period of time, often for first responders and essential healthcare workers, to meet what could be an eye health need. And you just don't feel comfortable going into the environment no matter what protocols are in place. And so that's a solution that's been working well since early April, and one will continue as long as we're in this environment.
Wow, that's really great too, and gives everyone the option to see a doctor and get that help. But also with more and more people online looking at screens, of course, everyone's doing Zoom, we're just kind of glued to the TV. So during this pandemic, can you share some tips with our viewers to really help reduce this digital eye strain? Because I can feel it myself.
That's right, especially if you have dry eyes, like you mentioned, right?
Yes.
And so I think there's 5 kind of quick tips for reducing digital eye strain, given we are all using the devices, as you mentioned, and it can create headaches, it can create blurred vision or dryness, as you said. The 5 tips are simple. 1, observe the 20-20-20 rule, which says for every 20 minutes you're on a device, take a break for 20 seconds and kind of look 20 feet or so. And so you're changing your point of focus. Number 2, you want to maintain your safe digital distance, which is usually arm's length for adults, and for kids as far away as you can. 3, you want to dim the lights, because you don't want that device to be brighter than the environment or the room that you're in. 4, there's often an app that you can do to certainly reduce blue light emission that comes from our handheld devices. And lastly, certainly probably most important, ask the expert. Ask your eye doctor about corrective lenses or smart screen lenses to help blue light emission that your eyes take in. And so really important in this moment. And regardless, whether you have a prescription or not, you might have that need lenses that reduce blue light emission, regardless whether you have corrective lenses or not.
Yeah, I have some pretty cool blue light glasses or blue light blockers that I wear, and I always get compliments on them. I'm like, you guys, I got these for like 10 bucks online. So they definitely help me, and I thank you so much for joining us this morning because
Absolutely.
it's something that we're all going through. And so for more eye health tips, we'll be sure to post a link to VisionWorks America's website at KOIN.com.